During a discrete trial, a child correctly labels a picture of a dog, but immediately looks away and does not respond to praise. What is the best next step? A. Continue with the next trial without delivering reinforcement. B. Adjust reinforcement to something more motivating. C. Deliver reinforcement even if the child looks away. D. Stop the session entirely. Answer: C. In discrete trial teaching, always immediately reinforce a correct response, even if the child looks away. This ensures the behavior is strengthened and learning continues effectively. Which of the following is an example of a functional communication response? A. A child crying until someone gives attention. B. A child pointing to the fridge when thirsty. C. A child ignoring instructions. D. A child throwing objects when frustrated. Answer: B. Functional communication replaces problem behavior. Pointing to the fridge when thirsty is a functional request, unlike crying or throwing objects. You are running a preference assessment, and the client consistently chooses the same toy. What should you do next? A. Rotate new items into the assessment. B. Use only that toy as reinforcement. C. Remove that toy to force other choices. D. Stop the assessment immediately. Answer: A. Preference assessments should be dynamic. Rotating in new items ensures that you identify a variety of reinforcers instead of relying on a single one. A BCBA instructs you to collect duration data on a tantrum. Which tool is most appropriate? A. Partial interval recording. B. Momentary time sampling. C. ABC checklist. D. Continuous stopwatch measurement. Answer: D. Duration data requires exact measurement of how long the behavior lasts. A stopwatch or timer is the most accurate tool for this purpose. An RBT is implementing extinction for escape-maintained behavior. What will extinction look like? A. Ignoring the child during all activities. B. Preventing escape after problem behavior occurs. C. Giving extra reinforcement after the behavior. D. Shortening demands to avoid escalation. Answer: B. For escape-maintained behavior, extinction involves not allowing escape following problem behavior. The demand remains in place until compliance. Which of the following best demonstrates shaping? A. Reinforcing only the final target behavior. B. Using punishment until behavior improves. C. Giving reinforcement randomly for any response. D. Reinforcing successive approximations toward a goal behavior. Answer: D. Shaping is the process of reinforcing closer and closer approximations of the desired behavior until the final goal is reached. If an RBT is asked to implement a procedure they do not understand, the best action is: A. Attempt it anyway to avoid delays. B. Ask the BCBA for clarification and training. C. Refuse to work until replaced. D. Invent an alternative method. Answer: B. Ethical practice requires seeking supervision when unsure. Implementing without understanding risks client safety and data accuracy. Which of the following is a continuous measurement procedure? A. Frequency. B. Partial interval. C. Whole interval. D. Momentary time sampling. Answer: A. Continuous measurement captures every instance of behavior. Frequency, duration, latency, and rate fall into this category, unlike interval sampling methods. A client is reinforced with candy after every correct response. Over time, the child stops responding. What principle likely occurred? A. Generalization. B. Habituation. C. Satiation. D. Extinction. Answer: C. Satiation happens when a reinforcer loses effectiveness after repeated use. In this case, candy stopped motivating the child. Which is the best way to reduce prompt dependency? A. Continue using full physical prompts. B. Use the least to most prompting hierarchy. C. Fade prompts systematically over time. D. Eliminate prompts entirely at once. Answer: C. Prompt dependency is avoided through systematic fading, ensuring the learner eventually performs independently. An RBT observes a sudden increase in aggression after a behavior plan introduces extinction. What is this called? A. Spontaneous recovery. B. Extinction burst. C. Response generalization. D. Overcorrection. Answer: B. An extinction burst is a temporary increase in frequency or intensity of behavior when reinforcement is removed. Which scenario best demonstrates generalization? A. A child says dog only when shown a flashcard of a poodle. B. A child refuses to respond outside therapy. C. A child says dog when hearing the word cat. D. A child says dog when seeing a poodle, bulldog, and German shepherd. Answer: D. Generalization occurs when a skill is applied to different people, settings, or stimuli, not just the training example. A behavior occurs on average after every 5 correct responses. This describes A. Fixed interval schedule. B. Variable ratio schedule. C. Fixed ratio schedule. D. Variable interval schedule. Answer: B. A variable ratio (VR) schedule provides reinforcement after an average number of responses, leading to high steady rates of responding. During data collection, the RBT forgets to record several instances. What should they do? A. Fill in estimated numbers later. B. Leave blanks in the data sheet. C. Inform the supervisor and note the error. D. Discard the entire data set. Answer: C. Honest reporting requires noting errors and informing the BCBA. Data must never be falsified or estimated. A client is taught to request water by signing drink. Later, the client uses the same sign at home. This is an example of A. Maintenance. B. Discrimination. C. Generalization. D. Extinction. Answer: C. The skill transferred from therapy to a natural environment, demonstrating generalization across settings. What should the RBT do if the client begins engaging in self-injurious behavior (SIB) that risks immediate harm? A. Collect data silently while it happens. B. Use trained safety procedures and seek assistance. C. Ignore it completely to avoid reinforcing it. D. Leave the room to get help, leaving the client alone. Answer: B. RBTs must prioritize client safety by following trained safety protocols and seeking support while maintaining supervision. Which of the following is an antecedent intervention? A. Reinforcing correct responses. B. Ignoring tantrums after demands. C. Providing choices before presenting a demand. D. Recording frequency of hand flapping. Answer: C. Antecedent interventions occur before behavior and can prevent problem behaviors. Offering choices increases compliance and reduces resistance. Which best describes pairing in ABA? A. Delivering reinforcers without demands to build rapport. B. Punishing problem behaviors immediately. C. Asking the client to imitate therapist actions. D. Using errorless teaching. Answer A. Pairing involves associating yourself with reinforcement so that the learner views you as a positive, fun person, building cooperation. Which of these best illustrates functional behavior assessment, FBA? A. Collecting data on behavior only once. B. Guessing the cause of behavior. C. Systematically identifying antecedents, behaviors, and consequences. D. Providing reinforcement without analysis. Answer C. An FBA involves systematic data collection on ABCs to identify the function of behavior and guide interventions. A child completes a puzzle only when prompted with "do the puzzle." The BCBA asks you to use a delay before prompting. This is called A. Error correction. B. Time delay prompting. C. Chaining. D. Backward fading. Answer B. Time delay prompting teaches independence by delaying prompts, giving the learner a chance to respond on their own. A client independently washes hands in therapy but refuses to do so at school. This shows a lack of A. Maintenance. B. Generalization. C. Shaping. D. Reinforcement. Answer B. The skill did not carry over to the school environment, showing a lack of generalization. Skills must be practiced in multiple settings for long-term success. A BCBA instructs you to implement forward chaining to teach shoe tying. What does this mean? A. The client learns the last step first. B. The client learns each step simultaneously. C. The client begins with the first step and gradually adds more steps. D. The RBT completes all steps every time. Answer C. Forward chaining teaches skills step by step, starting with the first action and building sequentially toward the complete behavior chain. Which example best illustrates negative reinforcement? A. A child gets candy for completing math problems. B. A loud noise stops when the child puts on headphones. C. A child loses a toy for misbehavior. D. A teacher gives extra playtime after good behavior. Answer B. Negative reinforcement is the removal of something aversive following a behavior, which increases the likelihood of that behavior in the future. If a behavior plan specifies differential reinforcement of alternative behavior, DRA, what should the RBT do? A. Reinforce only problem behavior. B. Remove reinforcement entirely. C. Punish all behaviors except the target one. D. Reinforce a desirable behavior that replaces the problem. Answer D. DRA means reinforcing a replacement behavior that serves the same function as the problem behavior, while withholding reinforcement for the problem behavior. Which of the following is an example of a permanent product recording method? A. Timing how long tantrums last. B. Counting the number of math worksheets completed. C. Observing whether a child stays seated. D. Tracking how often hand flapping occurs. Answer B. Permanent product recording measures behavior by its outcome, such as completed worksheets or assignments, rather than direct observation. When delivering reinforcement, it is most effective to A. Give it immediately after the behavior. B. Delay it until the session ends. C. Deliver it randomly throughout the day. D. Wait until multiple correct responses occur. Answer A. Reinforcement should be immediate to strengthen the connection between the behavior and its consequence, especially in early learning. A child engages in problem behavior only when asked to do difficult tasks. The function of the behavior is most likely A. Attention. B. Escape. C. Tangible. D. Automatic. Answer B. If the behavior consistently occurs when demands are placed, the function is likely escape from tasks. What is the primary purpose of data collection in ABA? A. To satisfy insurance requirements. B. To evaluate staff performance. C. To guide decision-making and treatment adjustments. D. To increase session paperwork. Answer: C. Data collection ensures treatment is based on objective evidence, allowing supervisors to make accurate program decisions. Which of the following is an example of a discriminative stimulus, SD? A. A teacher says, "Touch your nose," and the child does it. B. A child claps randomly. C. A child runs when no instruction is given. D. A toy that makes noise when pressed. Answer: A. An SD signals that reinforcement is available for a specific response. Touch your nose followed by reinforcement makes it an SD. A BCBA instructs you to use intertrial interval, ITI. What does this mean? A. Short breaks between instructions. B. Ignoring the child after errors. C. Delivering reinforcement continuously. D. Increasing demand difficulty. Answer: A. The intertrial interval is the short pause between trials that allows the child to process, reset, and prepare for the next instruction. A token economy is effective because tokens act as A. Primary reinforcers. B. Punishers. C. Conditioned reinforcers. D. Unconditioned stimuli. Answer: C. Tokens are conditioned reinforcers because they gain value when exchanged for backup reinforcers like toys, food, or activities. If a child engages in stereotypy during instruction, what is the best immediate response? A. Stop all teaching. B. Redirect to the current task and provide reinforcement for engagement. C. Punish the behavior immediately. D. Ignore the child until it stops. Answer: B. Redirecting and reinforcing task-related behavior ensures instructional control while reducing stereotypy without harsh punishment. Which is an example of whole interval recording? A. Marking if a child is on task for the entire 10-second interval. B. Recording every instance of a behavior. C. Checking only at the end of the interval. D. Counting the total number of responses. Answer: A. Whole interval requires the behavior to occur for the entire duration of the interval to be recorded as occurring. A child learns to greet peers with hello in therapy and later says hi at the park. This is A. Response generalization. B. Stimulus discrimination. C. Extinction. D. Prompt dependence. Answer: A. Response generalization occurs when the learner uses a different but related response, e.g., hi instead of hello, to achieve the same outcome. When teaching a new skill, which reinforcement schedule is most effective at first? A. Fixed ratio 10. B. Variable ratio 5. C. Continuous reinforcement. D. Fixed interval 15 minutes. Answer: C. Continuous reinforcement, CRF, is best when teaching new skills because every correct response is reinforced, strengthening learning. A client receives reinforcement after every fifth correct response. What schedule is this? A. Fixed ratio 5. B. Variable ratio 5. C. Fixed interval 5 minutes. D. Variable interval 5 minutes. Answer: A. A fixed ratio 5, FR5, schedule means reinforcement is delivered after exactly 5 correct responses. When graphing data, the x-axis typically represents A. Behavior. B. Time or sessions. C. Reinforcement type. D. Frequency count. Answer B. In ABA graphs, the x-axis represents time, days, sessions, or trials, while the y-axis shows behavior measurement. If a client's behavior plan specifies DRO, what should you reinforce? A. Any behavior similar to the problem. B. The absence of the target behavior during a set interval. C. All behaviors at random times. D. Only the target problem behavior. Answer B. DRO, differential reinforcement of other behavior, involves reinforcing the absence of the target behavior within a specific time frame. A child tantrums and is given an iPad to calm down. This consequence most likely maintains the tantrum through A. Automatic reinforcement. B. Escape. C. Tangible reinforcement. D. Attention. Answer C. If the tantrum results in receiving a tangible item, the iPad, the function of the tantrum is tangible reinforcement. What is the most ethical way to protect client confidentiality as an RBT? A. Discuss client details only with friends. B. Share session videos on social media without names. C. Discuss client information only with the treatment team. D. Save client notes on personal devices. Answer C. Ethical guidelines require RBTs to share client information only with authorized team members directly involved in treatment. Which is the best example of a functional reinforcer? A. Giving water when a client requests a break. B. Giving candy when a client asks for water. C. Allowing escape when a client requests a toy. D. Withholding reinforcement until the end of the day. Answer A. Functional reinforcers match the client's request or motivation, e.g., water when thirsty, making them more effective. A BCBA asks you to run a task analysis. What should you do? A. Break the skill into smaller, teachable steps. B. Reinforce only the final step. C. Punish errors immediately. D. Skip easy steps to speed progress. Answer A. Task analysis involves breaking down complex skills into manageable steps for systematic teaching. Which of the following is not an ethical responsibility of an RBT? A. Following the treatment plan as written. B. Collecting accurate data. C. Protecting client dignity. D. Modifying procedures without supervisor approval. Answer D. RBTs must never modify plans independently. All changes must be made under supervision of a BCBA. A client's problem behavior decreases after staff consistently reinforce alternative requests. What principle explains this? A. Punishment. B. Extinction. C. Differential reinforcement. D. Chaining. Answer C. Differential reinforcement strengthens alternative behaviors while reducing the problem behavior. A client engages in eye contact when greeted. To increase this, you should reinforce A. Only long-lasting eye contact. B. Every instance of eye contact at first. C. Only eye contact with specific staff. D. Only eye contact during group sessions. Answer B. Reinforcing every instance initially builds the skill. Once consistent, reinforcement can be thinned. Which of the following is an example of response cost? A. Giving extra tokens for correct answers. B. Providing extra homework. C. Ignoring the behavior entirely. D. Removing a token after inappropriate behavior. Answer D. Response cost involves removing a reinforcer, e.g., tokens, contingent on problem behavior, decreasing future occurrences. When using a multiple stimulus without replacement, MSWO, preference assessment, what happens after an item is chosen? A. It is placed back in the array. B. It is removed from the array. C. It is immediately replaced with a new item. D. It becomes the only reinforcer used. Answer: B. In MSWO, once an item is chosen, it is removed from the array, and the process repeats until all items are ranked. Which is the best example of a conditioned reinforcer? A. Food. B. Water. C. Money. D. Sleep. Answer: C. Conditioned reinforcers, e.g., money, acquire value through learning, unlike unconditioned reinforcers like food and water. If a client's skill improves only in therapy but not at home, what should the RBT focus on? A. Punishment procedures. B. Generalization programming. C. Data collection accuracy. D. Token economy adjustments. Answer: B. To ensure the skill is useful, programming must include generalization to natural environments, like home and school. Which of the following actions is most consistent with the RBT Code of Ethics? A. Implementing procedures exactly as trained. B. Accepting gifts from a client's family to build rapport. C. Giving personal advice unrelated to treatment. D. Sharing client details with peers outside work. Answer: A. Ethical practice requires RBTs to implement procedures as trained and supervised, without adding personal methods or crossing professional boundaries.